How can acute myeloid leukemia patients reduce their risk of developing graft versus host disease?
Clearly, patients who come into transplant are very educated in their disease, very invested in having the very best outcome that is possible. So many of the things that could influence on them are out of their control. I do like to make sure patients know that for the most part, there are not behaviors or diets or exercise regimens that are going to ensure success. And I think taking away that responsibility in some ways is important. But there are a handful of things that I always do tell patients can help avoid those obstacles as best we can. And that actually comes in the way of avoiding unnecessary inflammation, meaning remembering that graft versus host disease is that new immune system that we've engrafted in there, that powerful immune system acting up against a tissue that we don't want it to. I will tell patients that, for a long time after transplant, I want them to stay out of the hot sun and I want them to wear, good long clothing and, 50 plus sunscreen, because getting a bad sunburn can precipitate skin GVHD. And if you think about it, it can make some sense, right? You burn your skin, you invite all the inflammation, cells that might come in first trying to heal the tissue, all of a sudden, might overact in that way and then attack those same tissues. So things like that. We have seen that virus infections can be an inciting factor for people to develop GVHD that might otherwise not have. So you can't always control when you get a viral infection, but all of our patients sort of know to be as careful as they can and sort of follow good hygiene protocols and infection prevention protocols. After that, the most important thing is simply good communication with your team, so that if you notice something, letting them know so that whatever it is can be acted on and investigated early, because that absolutely can prevent some of the sort of severity of symptoms that can come along as well.